Let's begin with the third section of our lecture, Encephalitis Diagnosis. And in this section, we will talk about the culture of the cerebrospinal fluid. What are the properties of cerebrospinal fluid culture? What are the serological studies that can be done in the detection of the viral encephalitis and also the antigen detection? Antigen detection of herpes simplex virus and varicella-zoster virus encephalitis. So all that we will talk about in this section, which is the third section of our lecture. So CSF culture. Culture is the test or procedure that is performed to detect the exact cause of the causative microorganism. And the main purpose of this culture is usually when the therapy is initiated in the beginning and then patient is not getting benefit from the therapy as expected, then we should go for the culture. The drawback of this procedure is that it takes time. At least 48 to 72 hours are required for the culture. So in that period, if in some cases, if the treatment is not initiated, then it can lead to complications. But in most cases, if the therapy is not effective and it's not helping, then we need to go for the culture. So we should know the exact causative agent and we should start the antibiotics for the causative agent, so the patient should get benefit from it. So the culture is usually performed in these are the petri dishes in which the culture is done, and the culture is performed on specific culture media to grow the causative organisms. So these are the petri dishes. CSF culture in case of viral encephalitis or viral infections, usually the culture is not very effective and it does not help in the diagnosis. So limited utility of the culture in the encephalitis, because we know that mostly the causative agent in case of encephalitis are the viruses. May be insensitive also. And herpes simplex virus encephalitis, usually the cultures are negative. Takes too long. As I mentioned, sometimes the culture require about 48 to 72 hours, about 2 to 3 days are required for the culture. So sometimes it is preferred that the therapy should be initiated that has the maximum coverage against different microorganisms, so it should cover. And besides, usually the viral infections usually take its course and treatment is mostly is just on the symptomatic basis. Conservative management is performed other than some antiviral therapies against some viral infection. So culture is, that's why it has very limited ability when we talk about the diagnosis. Next, serologic studies and antigen detection. This is also very helpful in the diagnosis when we detect the presence of antigen and antibodies against different infections, and this especially after the polymerase chain reaction is negative. This helps us to detect the causative organism. So serological studies, the viral, in case of encephalitis caused by the West Nile virus, the serological studies detects the presence of IgM antibodies, demonstration of West Nile virus IgM antibodies. Antigens are present. Against those antigens, we have antibodies formed, and detection of those antibodies, which can be IgM, IgG antibodies, is helpful in making the diagnosis of the condition. So in West Nile virus encephalitis, we have the IgM antibodies present. Then the antibodies which are formed, usually they do not cross the blood-brain barrier. So presence of these antibodies, it explains that their synthesis is in the intrathecal, in the space, because they cannot cross the blood-brain barrier. Timing of antibody collection is also important to find out what is the stage at which the condition is present. So all these steps are helpful in diagnosing the Western Nile virus encephalitis, IgM antibodies present. Since antibodies do not cross the blood-brain barrier, that indicates that they are formed intrathecally, and the timing of the collection is important. Next, antigen detection of herpes simplex virus encephalitis. We already mentioned cultures are negative. Cerebrospinal fluid cultures cannot detect herpes simplex virus in encephalitis. So antigen detection will be helpful. Antibodies are present to herpes simplex virus 1 glycoproteins. Also, antigens are present in the cerebrospinal fluid in case of herpes simplex virus infection. Also, optimum detection is after the first week of illness. So it's not the immediately, we cannot detect these antigen and antibodies. It's after the first week of illness. So acute detection of this illness is not possible by finding the antigens against herpes simplex virus encephalitis. Limited utility in acute diagnosis because at least 1 week is required for the detection of these antigens. Useful in cerebrospinal fluid polymerase chain reaction negative cases. So if the polymerase chain reaction is negative, detection of antigens and antibodies, they are very helpful in finding the herpes simplex virus encephalitis. Next, antigen detection after herpes simplex virus. Now, varicella-zoster virus. Again, we have antibody may be positive. We can detect the antibodies in varicella-zoster virus infection. When polymerase chain reaction fails, same as with the herpes simplex virus infection. When this fails, we can find polymerase chain reaction fails, we find the antigen against the varicella-zoster virus infection. Both tests are complementary rather than mutually exclusive. So they are just complementary add-on. That concludes our section 3. Thank you for watching sqadia.com.